The initial treatment for hip impingement is usually physical therapy. The goal of physical therapy is designed to try to strengthen all of the muscles that stabilize the pelvis and hip in order to try to minimize the bony contact or impingement that could occur. If physical therapy is unsuccessful, then more aggressive measures may be necessary. In addition to physical therapy, oftentimes anti-inflammatory medication or injection in the hip can be tried as a way to try to reduce inflammation in the hip joint as a result of the impingement that's occurring. If these measures prove to be ineffective in alleviating the athlete's pain, then surgical intervention becomes an option. Hip arthroscopy is a technique that's been developed relatively recently to treat impingement of the hip. Previously, we did not have a great treatment option for athletes that suffered from this condition. Arthroscopic hip surgery is a relatively new technology that's been developed to treat hip impingement. It's an outpatient procedure that is performed through a couple of small poke hole incisions about the hip joint. The goal of arthroscopic surgery is twofold. First of which is to remove the extra bone that is formed either along the edge of the ball or the rim of the socket of the hip joint that was causing the impingement to occur. Secondly, repair to the damage to the labrum can be accomplished by reattaching the labrum to the rim of the socket. This procedure, performed on an outpatient basis, can allow for the athlete to be able to return to running, jumping, and other competitive sport that allows for proper resumption of range of motion of the hip joint without that bony impingement occurring. Therefore, the athlete's groin pain typically will resolve with arthroscopic treatment for this hip impingement, thus allowing them to return to full competition that they were accustomed to doing prior to their injury. Hip impingement is usually an accumulation of repetitive activity that has resulted in the bony contact between the ball and socket of the hip joint that results in injury to the labrum. It is usually not the result of a single event. Rehabilitation following arthroscopic hip surgery usually involves the individual being placed on crutches for about 4 to 6 weeks after surgery to allow for protection at the surgical site. Physical therapy is usually initiated within a couple of days following surgery to begin gentle range of motion exercises in a safe zone to protect any repair that may have occurred. Physical therapy is advanced to focus on additional range of motion exercises and then strengthening exercises for the hip. Usually an athlete is in physical therapy for about 8 to 12 weeks following arthroscopic hip surgery. Return to athletic competition following arthroscopic hip surgery is usually in the realm of 4 to 6 months, depending upon the severity of the condition being treated.